All right, hello everyone. My name is Deontay. I am going to be providing your training today. And today we will be talking about medical error prevention and safety with the theme of the presentation as to err is human. And I will explain that theme later on in our lesson. So let's begin. All right, so medical error prevention and safety to err is human. Again, my name is Deontay Marquis. Our course objectives for today. Um, First, we will try and understand the different types of error. Um, there are a couple different kinds that occur in the hospital. So I want you to understand the different types that there are, and also the importance of each as to how they relate to your profession, what you should do if you so happen to cause one of these errors or notice another coworker caught up in one of these errors, and the importance of each to making sure we can provide a safe environment to the patient. Also, you should be able to identify common causes of medication error at the end of this presentation. So we'll talk into that because if you know the common causes and what they are, or you can even identify a few, then you'll know where to really focus your attention throughout the day to decrease the likelihood that you may cause a medication error. So it's very important that we know and understand the common causes of medication errors. Also, by the end of this presentation, you should know the importance of reporting medication errors. So you'll hear in the medical field or at your facility, the managers, they want you to report these medication errors, and it's the right thing to do. Even in instances where they don't necessarily cause harm to anyone, to the patient. Maybe it was could be a medication that the patient used to take but doesn't take anymore for whatever reason, and you happen to give it to them, uh, or you don't give a patient a medication that they need to take, and nothing happens. But we still need to know the importance of why we should report those two types of scenarios. So we'll talk about that. And lastly, the last objective for today's course, you should be able to identify various safety practices that can help you prevent medication error, of course, and also understand their impact, how they affect patient safety, not just in that scenario, but in future scenarios and in past scenarios, because there's something about the reporting of an error um, that can help improve patient safety significantly in the future. So those are our course objectives for today. And we are going to make sure by the end of this presentation, you are able to fill each one of those blank boxes with a check saying, yep, Deontay, I really took a lot away from your presentation and I definitely feel comfortable putting a check, noting that I understand those four course objectives for today. So, first, you saw it in the title, To Err is Human, and I have it quotations. So, basically, To Err is Human was the title of a report released by the Institute of Medicine in 1999. And you'll see the rest of the title is Building a Safer Health System, because in 1999, that's when it first really started to set in the minds of people in the healthcare profession and researchers specifically that um, the amount of deaths and instances of medication error was having a significant effect on the positive outcome of patients during their hospitalization or care by a medical professional. So there was a Harvard team of researchers and doctors, and they launched a study and gave that information to the Institute of Medicine. And from that study, it showed that 70% of errors resulting in adverse events were due to negligence. Um, So that's huge. That's 7 out of 10 errors were just negligent oversights, things that can easily be prevented. That's why it's so important because we're caring for the patient. We want to do the least amount of harm to the patient. We want them to get better when they're with us. And if 70% of errors that occur during their hospitalization is on our hands that can be prevented, then we need to do something about that. And that's what the second point here from the study reinforces, that more than 90% were judged to be preventable. So imagine the amount of money saved by the hospital, by the insurance company, by the patient, not just the money, the what those errors were and how they could have affected the patient negatively, leading them to stay at the hospital longer, and they could have gotten better quicker and went back to their normal life. So this report by the Institute of Medicine was a huge milestone in medical professionals recognizing that we need to do something and we need to do something fast. So the different types of errors. So there are different names for each of these. So if you look online and Google different types of errors, you'll see their different names. But these are the four that were taught to me. I'm going to teach to you. This is how they were classified. And also there was a report by the Joint Commission where they also use these specific terms. So these are the same ones. If you see different names, you'll easily be able to identify which name is just a synonym of the term used here. So there's a medication error. Uh, we're going to talk about each of these. I'm just going to read through them. Medication error, an adverse event. We're going to talk about how those two are different, and we're going to talk about errors of omission and errors of commission. Okay, so we're going to talk about how those two are different. And of course, we'll talk about how all four relate to your practice and making sure we keep our patients safe. So first up, we're going to talk about a medication error. So a medication error is a medical error that actually is caused by management of the patient and not their underlying disease. So if a patient comes in, very simple, patient comes to you and says they have a headache, and you give them Advil when they always take Tylenol because Advil causes them to feel sick, vomit. So you give them the Advil, you give them the Tylenol instead of the Advil. The headache goes away because those two medications have similar effect, but they become sick. So you have just committed a medication error. It's injury caused to the patient by medical management. So it's injury caused to the patient by the medication you provided to them, medical management, rather than the underlying disease that they presented to you with, which was a headache, because you gave them the wrong medication that made them sick. So this is medication error. Adverse event. An adverse event is the result of a patient becoming harmed by a medication error. And that's why I have written under, not all medical errors lead to adverse events. In fact, most do not. Now, in terms of defining what a specifically adverse event is, that's going to be very specific to scenario. The scenario that I gave you, where a patient vomited, where I work in the ICU, the patient vomiting, a healthy patient was complaining of a headache. You gave the wrong medication, the headache went away, but they threw up or they just felt really nauseous. Let's say they just felt nauseous. That would not be considered an adverse event. But if you gave them the wrong medication and they have a anaphylaxis reaction to it because they have this horrible allergy to the medication, that would definitely be considered an adverse event. So remember, not all medical errors cause adverse events. Adverse events is when you actually cause harm to the patient. Um, so keep that in mind and know the difference between those two, an adverse event and a medication error. Okay, now we have errors of omission. Um, Errors of omission is an error that is caused by not taking an action. So I'll put example here. When you don't strap a patient to a wheelchair or stabilize their gurney prior to patient transfer. So that's an error of omission. You didn't do anything to the patient that made them fall when you wheeled them through the halls in the gurney. You went slow, you looked out on all the turns, you told the patient, don't try and get up until I tell you so, until we've stopped. But by your lack of action, um, you caused harm to the patient. That there was an error. Or remember the difference between adverse action and medication error. This wouldn't be a medication error, but just the error. Um, you don't have to cause an adverse event by an error of omission either. So we have medication error. That's when you give the patient uh, the wrong medication. We have adverse event. That's when your management of the patient causes harm to them. And we have error. Now we have error of omission, and that's just a result of actions not taken. Lastly, we have errors of commission. So an error of commission is exactly what you're probably thinking. The opposite of errors of omission is when you take the wrong action. So I put here an example, excuse me, administering a medication to which a patient has an allergy or not labeling a laboratory specimen that is subsequently ascribed to the wrong patient. So errors of commission is you did the wrong thing. So if I gave a patient medication and they had an allergic reaction, um, that technically I would have committed one, a medication error, two, that medication error caused a adverse event, and three, it was an error of commission. I took the wrong action. So that's uh, important for you to note these different types of errors when reporting an error or when asked to document about an error. It's important to be able to give whoever reads your report this clarity in telling them what type of error happened and really painting a clear picture so that the proper actions can be taken in the future. So next we're going to get into, so what are some common causes of these medication errors? Why do people make these medication errors? We're living in a day and age where everything is computerized. We have a lot of checks and balances. Not everywhere things are computerized. I've worked at places recently where charting and things are on paper, but why are people still making these medication errors? If the report from the Institute of Medicine came out in 1999, over 20 years ago, telling us that our errors were making up a very large and significant part of the health care these patients are receiving. What's going on? So you can see here in the middle, I put medication errors and some of the very common causes of these medication errors. So fatigue, incorrect abbreviations, look-alike and sound-alike medications, inadequate training, and poor communication. Those are the five. Those are the five things that attribute to medication errors. And we're going to talk about each of these in detail next. So first, I want to talk about incorrect abbreviations. And basically, this slide is very straightforward. I listed for you the official do not use list. You see it here on the slide. I'm not going to read it to you, but I'm going to talk you through it. So do not use on the left-hand side column a U for unit. Instead, write the word unit out. Um, do not use IU, internal unit. Instead, write the uh, those words out. So basically what this slide is showing you is you should see unit and unit. You can see how easily if you write a U and then someone writes an IU, depending on their handwriting, you may make a mistake. And these mistakes, uh, moving one decimal point, 1.0 over to the left or over to the right, significantly decreases or increases the dose of a medication, and as a result can have a huge impact on its effect on the patient or lack of effect. So trailing zeros, lack of a leading zero. This is the fourth row down on the far left column. A decimal point can be missed. That's the potential problem. So instead of using trailing zeros, write X. So this is the proper way. This is the proper way uh, that you should use and not use abbreviations when you're trying to communicate, or even when you're reading communication from a doctor or a nurse practitioner or anyone who's writing orders on your patient's chart. If you're seeing that they're using incorrect abbreviations, you need to highlight the abbreviations that are incorrect on that order and seek clarification, because ultimately we are the line of defense before errors occur to the patient. So if we see something that we're unsure of, we have to seek clarification. And maybe the doctor was suffering from, or the healthcare practitioner was going through one of the 5 factors that we just showed you in the previous slide that caused them to make a medical error and a lack of judgment. So we want to bring it to their attention and let them know. And then here, it's an additional list of what to use and what not to use. So here you see, do not use a greater than or less than sign. Instead, write it out. Do not use abbreviations for drug names. Write the name out. Do not use the @ symbol. I know in today's world, that symbol is very popular in text messaging, but when you're at work and when you're writing it out, you want to write the word at. Do not use CC, instead use milliliter or ml. So basically your takeaway from these 2 slides about incorrect abbreviations is you want to make sure that you're writing things out. You don't want to leave anything for anyone to guess. And you don't, of course, want to guess. Or you don't want to make the wrong decision, or you don't want your handwriting to aid someone in making the wrong decision. This is a huge factor in the medication errors that can occur, and one that we can very easily rectify. So it's important, if you're using abbreviations, please stop. If someone around you is, let them know, hey, that's a big risk for a medication error to occur for you and ultimately affecting one of your patients. Next up, this is one of my pet peeves: look-alike, sound-alike medications. So you'll see here, I tried to make them as big as possible. Uh, we are looking at 6 different medication vials. In the box on the left, you'll see we have Novolog and Novolin. Um, they're not so similar, but the vials do look very similar, except for the small red and the small blue. Now, just imagine you're giving insulin to all of your patients. Each one is on a different medication. You go to one's on Novolin, one's on Novolog. You got both in your pocket. You're in the patient's room. You've been busy all day. The patient's asking for the insulin. They're ready to eat. This can be a problem because you'll ask yourself, is this patient on Novolin or Novolog? Or maybe you already drew up their insulin syringe with the appropriate insulin and labeled it like you're supposed to do, but you go in your pocket and you can't remember which one was for which. Novolin, Novolog. You can see how it can get very confusing. Even for the patient, if you ask them, hey, what type of insulin are you on? They'll say, oh, I'm taking Novolog, or oh, I'm taking Novolin. They can get mixed up themselves. It's happened to me before. Can happen to you. It happens all the time. In this middle picture, we have sterile water and calcium gluconate. The vials are exactly the same. If you're working at night shift, you're in a rush, they both even have some pink on the label. So uh, that's another one, just demonstrating how these medications look alike and sound alike. And last, you'll see we have sodium acetate and potassium phosphate. Um, Very similar. The only thing, I think, the vial on the right, the potassium phosphate, doesn't have the lid on top. I'm pretty sure the lid on potassium phosphate is also gray. So that's just to show you, uh, here we go, some more medications that sound alike. So those were medications that looked alike. So we have dobutamine, dopamine, dobutamine, uh, dactinomycin, daptomycin, hydralazine, hydroxyzine. All these, it's 20 medications, 40 medications that look alike, just on this list. So what can we do to make sure that we don't grab the wrong medication, or we don't give the wrong medication to the patient? We have to use good communication, and that's what we're going to talk about here. I titled the slide Poor Communication. So if there is an alternative, don't use verbal. Don't take verbal orders when transcribing medications. When taking an order or writing something down, or if the patient you're admitting tells you, "Oh, I take Novolin, I take Novolog," don't write it down. Just say, "Oh, can you spell that for me?" Or "Can you write that name down for me?" Because while they're writing it down, it may uh, they may see that, oh wait, I'm saying Novolog, but I mean Novolin. It's happened before. Also, have a second person listen to the verbal order if you're taking one from a doctor. Um, a lot of the times the doctors are taking care of a lot of patients. They're very busy. They're trying to give the order quickly. So you want to make sure that you slow them down to make sure you get the right order. Um, Verbal orders sometimes need to be clarified by the pharmacist, a manager, or a coworker. So to save yourself from going through all of that, you want to take the message from the doctor slowly. Yes, hello, doctor. I know you're in a rush, but when you gave me that order, I'm not sure if I wrote it correctly. I want to make sure that I transcribed the medication correctly. Can I read it back to you? The receiver should read back the order always to confirm understanding. Um, you read the order back to the doctor slowly, clearly, exactly what they said, and you write it out, and you write it out the words. You don't write down the abbreviations, because if you write down the abbreviations while you're trying to jot everything down over the phone from the doctor, when you hang up with the doctor and then look at what you wrote, you might not be 100% certain, and then you'll have to call the doctor back again. And all that's just putting your patient at a higher risk um, for a medication error, because now the doctor has to remember what he told you, what the scenario was, and what his train of thought was to give you that order, and if it's correct. So you want to develop these guidelines for yourself, for the patients, and for the rest of your staff. You tell yourself, okay, to prevent medication errors, I'm going to write down the brand and the generic name. Or you can go a step further and write down the purpose of the medication for that specific patient, or an indication. Um, and then at the bottom here, I made a note. The person authorized to accept verbal orders records the verbal order directly onto the appropriate medication orders sheet, or enters the order electronically, writes the name of the prescriber, and signs with his or her professional designation. So some places, you may want to bring it to your manager if you guys are experiencing a lot of medication orders. They have a set person to take the orders. Um, and this can be another reason why, how you can prevent, I'm sorry, making error when dealing with look-alike or sound-alike medications. You have to prevent worker fatigue. All of these things tie into each other, guys. That's why on the slide, a few slides back, when I had the green bubbles, everything was overlapping on each other because they all blend together and cause medication errors. They all attribute to uh, this preventable problem that we're having in healthcare. So, how do you know if you're tired because you're working hard and you're having a busy shift, but you're great at your job and you can get through it? You're tough. You've had rough days like this before. You can get through it, but is you getting through it, is it the safest thing for the patient? Should you stop and take a break? Do you have worker fatigue? What contributes to worker fatigue? Well, environmental stress, the lighting. Do you wear glasses? Is the lighting too bright for you? Do you need to get your prescription changed? Do you need to make sure you're not looking at the computer too long? Take a break. Is the temperature appropriate for you? Is it too hot? Is it too cold? And interruptions that can distract the staff and affect your performance. Um, this is extremely important for the healthcare because I don't remember exactly, and I didn't include it in here. It's just some anecdotal story I'll share with you. Um, there was a study, I believe it was in another country, not in the US, about the amount of interruptions that nurses in a hospital unit um, received while trying to give medications. And I think they were interrupted almost every 30 seconds or every 2 minutes. Somewhere some high frequency like that while trying to give medications. That is huge. That is huge. I know when I'm sitting at the bank and my banker's counting money or they're working in their computer, no one's interrupting them. No one's asking them for assistance with something else or to count something else or breaking their count. If they were, the bank would have a huge problem because the counters would be having miscounts at the end of every day. But in the healthcare field, that's the issue. We're getting interrupted all the time. So you need to make sure that when you're doing work that's very important, you stand up for yourself and you let others know, hey, I'm sorry, I'm really busy with something very important and I need to give this my full attention. I can be back with you in a moment if you will just give me 10 minutes to complete this task. Or you need to relocate somewhere where you can not be interrupted, where it's nice and quiet and the perfect lighting and temperature for you, some dream room, and you need to complete your medication passing. If there's family there, you need to let them know, hey, I'm happy to answer all questions about the medications I'm giving, but not right now, not until I give them or not until I prepare them. Also, physical stress plays a part in worker fatigue. Did you sleep well the night before? Are you thirsty? Are you hungry? Have you used the bathroom? We're on our feet a lot. We're helping people who can't do these things for themselves. So we almost feel like we shouldn't do them either, or we forget to do these simple things for ourselves. I mean, I'm referring to drinking and eating and bathroom. And a lot of people in the healthcare field are working for 8 and 12 hours, 12-hour shifts. That's really long. So we need to make sure that we're taking care of ourselves. We need to make sure that we've already identified that a task involving medication, any medication, deserves our full attention. And we need to let others around us know that this medication is very important and we need to give this task our full attention. And this is how we can prevent medication error. So, why should we even report medication error? So, I included this here, and this is the Swiss cheese theory of system error. So, you probably heard this before, but I'm using it here to demonstrate why it is important to report medication error. So, you'll see all the way to the right of the picture I included here. It says nurse prepares to administer a medication. And then the very next slice of Swiss cheese above it, no warning labels on dangerous medication. That's the first hole. There isn't a warning label on the medication to alert the nurse that, hey, we need to triple check this medication because it can be very dangerous. So the next oh, I'm sorry, I missed one. Right before that, it says different medications stored in look-alike bag. I already showed you how similar vials can look. Uh, so that can be done very easily. Excuse me. So no warning labels on dangerous medications. The medications were stored in lookalike bags, and then the third slice of Swiss cheese, an unanticipated increase in patient volume slash severity. So that means what they're saying is now all of a sudden the unit's getting busy, or patients on the unit are getting sicker. So that means you don't have people to help you. Things are getting busy, high stress level, more likelihood of worker fatigue, more likelihood of the quality of effective communication. The quality of communication is going down. And last but not least, there's a nurse staff shortage. Um, People are tired. They may be calling in sick, um, or just we don't have enough workers for this increased volume and severity. We had to change some things around with staffing, so we don't have the shortage. And just as simple as that, this occurs on an everyday shift. The patient receives the wrong medication and has a respiratory arrest. Just as simple as that. Just as simple. So why do we want to report medication errors? Why is it important for us to report medication errors? Well, it's important for us to report medication errors because they have a significant impact on patient safety. It's important because if on that previous slide, when the nurse or whoever was getting the medication saw that this dangerous medication didn't have a label, then they would have reported it to management. Then maybe management, hopefully, management would have pulled all those medications and had them labeled by another nurse or a manager, or labeled them herself or himself, or maybe even um, pulled the medication and ordered them from a different manufacturer. That may have alerted the nurse to take more precaution. So when the severity and the number of patients on the unit and things got busy and the nurse patient staff ratio went down, uh, they still would have saw, hey, this is a dangerous medication, gave it one more look and prevented that patient from having a respiratory arrest. Reporting errors is fundamental to error prevention. It's very important to understand that. And it's very important to talk to your managers about how they feel about error reporting and make sure that where you work, there is a safe process for you to report medication errors, or near misses, as some people call them. Um, and a near miss is just a medication error. Remember, we talked about medication errors early in the beginning of the shift. I'm sorry, the shift, early in the beginning of this presentation. And it's just when you give the wrong medication, but it doesn't cause an adverse event, it doesn't harm the patient. So, uh, reporting all errors, errors of omission, errors of commission, adverse events that result from medication errors, it's important to report them all because they could help prevent a future error. And that is ultimately our goal, to slowly decrease the amount of medication errors that harm patients. Errors that occur reflect problems in the system, not the individual. They reflect the problem in the system. Not that you or I shouldn't take some ownership for a mistake that is made. That's why I'm giving you these tools in this presentation today, so you can make the appropriate decision and not make these mistakes. But these errors, they do reflect a problem in the system, and they present an opportunity for improvement. Um, it's it's great when a near miss happens. One, because no patient was harmed, but two, because that's an opportunity for us to fix this problem before a patient is harmed. So you want to make sure that at the end of your busy shift, if you gave the patient the wrong medication, if you didn't strap them in because the straps weren't working tight enough, or whatever other reason, there's a problem with the pump, whatever reason, you want to make sure you report it to management. because this can prevent a serious problem from occurring for the next patient who may not be so lucky as the one you cared for and made the mistake with that day. So, why report medication errors? Reported errors have revealed in several different studies hidden dangers, near misses that point to system vulnerabilities, not intentional acts of negligence. And also, we should be reporting medication errors because we have an ethical obligation when we step inside these people's lives as healthcare workers performing this job. We have an ethical obligation and responsibility to protect them from harm, to keep them safe. Their loved ones trust us, they trust us, our managers trust us, and we owe it to them. It's our ethical obligation. We have to. And we've identified that reporting medication errors, near misses, even issues that don't cause any problems for the patient, they need to be reported. So I like getting things from the Joint Commission just because, when you get it from the Joint Commission, it's uncontested. So previous medication errors, the Joint Commission has set some patient safety goals just to help us in preventing medication errors. So this is what you should be striving for to help. And if you haven't done these, you see I have a red light, then you need to stop. Don't give the medication until you've mentally went through and done all of these, or you've learned to include these in your ritual before you give medications. Okay, have I identified patient safety dangers and risks? Have I identified the patient correctly with two identifiers, their name and their date of birth, their name and their address? Um, how can I improve communication, such as getting test results to the correct person quickly? Is my communication, did I communicate best with the patient? Did I communicate with the doctor? Did I communicate with the pharmacist correctly? All the information that I've gathered from those three different people, did I communicate with them the best? Did they include any abbreviations that are unapproved? Did I write down any abbreviations that are unapproved? Is there anywhere in the transcription of information that I've gotten from them that could possibly be incorrect? Of course, hand cleaning, making sure you're taking all precautions to prevent infections, making sure you're preventing mistakes in surgery by making sure the correct surgery is done on the correct body part. Pause, make sure you double check. So we're still sitting at the red light because there's still a list of things we need to do. Use device alarms. Make sure that the alarms on the medical equipment are heard and checked quickly. Device alarms are very important. And when I talk to older nurses or healthcare workers, it's a benefit that we have that wasn't always around. And we definitely should take advantage of it. You should always use the device alarm setting. And if you don't know how to use the device alarm setting, you should ask someone to show you. It's a very helpful tool on your medical equipment. Make sure that the volume is up on your pumps when you start your shift. Make sure that they're plugged in and make sure that they're functioning properly. Can't tell you how many times I've walked in and the only reason I knew my pump was functioning properly is because it was beeping very loud because it had no battery. The no battery alarm was beeping very loud. Thankfully, the no alarm battery always defaults to alarm very loud. So next, we're still sitting at the red light, guys. You want to use medicines correctly and safely, always double checking the label, always correctly passing on patient medications to the next provider. So when you're passing off a medication to the person relieving you, whether it's for lunch, for a break, for a shift, or onto a different floor, you want to make sure that you double check the labeling. You show them that, hey, look, that this patient is on these two medications and they're look-alike, sound-alike medications. Take note of this. You want to talk to them about the risk of the patient taking. If one of them is extremely dangerous for this patient, it's known to drop blood pressure. You want to make sure you bring all those things to their attention. You want to set them up for success because we want to keep the patient safe. And you can do that by labeling all medications, even those in a syringe. So if you are preparing a medication for a patient, let's say you're drawing up some type of solution that you're going to give to them by mouth, you want to draw it up in the syringe. You want to label what you put in the syringe, put a patient label on it so you know which patient it's for. You want to write the dose that's in. You want to write as much information as possible. Basically, you want to pretend that the syringe is now the medication label that you drew the medication from, because that is all the information that you will have. You can't bring all that medication, the medication bottle, another patient's medication, all that's in your pocket. You may forget it. The patient may say, "Hey, I want to sleep, continue sleeping. I don't want to take this medication right now. Can you come back in an hour?" And you have this medication in your pocket. You go to your next patient, give them their medications. You're doing other things. Maybe your next patient is also taking an oral solution that you also drew up in a syringe. Maybe another nurse asks you to help them by getting another oral solution that's given in a syringe. And now you have this syringe that's unlabeled in your pocket, and you don't know who it's for. So you're faced with this problem. You're faced with a ethical dilemma, a decision. Do I throw this medication away and just draw another one, but then I'll have to waste it, and so on and so forth? Make sure that you're writing down as much information as you can. A mental picture is not sufficient with medications. Um, Preferably, you should do all of this in the area where the medication is prepared. You should not be doing this at the bedside. Why is that? Not just because it makes sense. You keep a medication in where the medication came from, in the medication room, but because if you're in the medication room, it's less likely that you can be interrupted by another patient, by the patient you're giving the medication to, by another staff member, by family. So you want to make sure that you're setting yourself up for success. And you do this by staying in the medication room while you're preparing a medication. Um, you want to take extra time with patients who have been prescribed anticoagulants and chemotherapeutic agents. It's very important that you spend extra time with these patients because these are very known, very high risk, dangerous medications. Excuse me. So, we want to make sure that we're taking extra time with these patients because they're at high risk for bleeding. These medications are known to have interactions with other medications. And last but not least, remember I talked about trailing zeros and moving a decimal to the left or to the right. Um, these medications, if you move a zero to the left or the right, it could be fatal for the patient. Um, I don't know if you guys are familiar with the story about it's a very famous story. It's been passed along a lot in different orientations at different facilities that I've been to, but it was about a famous actor, and he had just had twins. It may have been twins, it may have been just one baby. I'm not sure. But he had just had a baby with his wife. Everything was going great. The babies went to the NICU. I don't think it was anything serious. But while they were there, they had jaundice. The babies went to jaundice, had jaundice, and the nurse gave them a fatal dose of blood thinners that caused them to die. Um, and the actor went on to become an advocate for an advocate against medication errors and bringing awareness to medication errors and how this can be prevented to not affect any other families, um, and just really, really bringing the awareness about this problem that's plaguing healthcare to the attention of the public, because it's been around since, as I talked about in the research study by the the IOM, it's been around for 20 years and probably longer, before it was even recognized. And people, there's still so far and so many things we can do to prevent medication errors. So we still have a long way to go. So look that up. Also, that's a good story for you to read to understand how easy and how fatal medication errors can be. Um, it's a famous actor loses young, a famous actor loses newborn baby. Search that. Okay, last but not least, back on track. To prevent nosocomial infections. Nosocomial just means outside of society. So you're in the hospital, so you're outside of the regular day-to-day society. Hand washing should be routine before and after visiting each patient. So we want to wash our hands all the time, especially before we give these patients a medication, because they're going to ingest it, and it's going to be directly introduced to the inside of their body. It's not just saying wash your hands before you greet them with the handshake. Wash your hands before you give them a medication, because if you took care of a medication that had a certain germ or infection and you come from their room, you don't wash your hands, and you give this new patient this medication, you just committed a medication error by commission, and it could or could not have an adverse event for this patient, especially if they're immunocompromised. That's why chemotherapeutic agents, when you're taking, you should take extra care with these patients. And that extra care should also be given not just to the medications, but to hand washing and preventing infection, because those patients are immunocompromised. And those are the ones that, if you did not wash your hands, they will become sick. And it will show immediately. And people will wonder what happened, how this patient gets sick inside the hospital. It'll because someone isn't washing their hands. So you want to make sure that that someone isn't you, and you want to make sure that that no one is that someone that causes that patient to be sick. So take it a step further and put a sign on the door. Make sure there's a sign saying "Wash hands, chemotherapeutic agents, or immunocompromised patient." Make sure your facility has those types of stops in place to prevent these preventable errors from occurring. Finally, we got the green light, preventing medication errors. So once you've done all those things, you've done your mental check inside your head, and everything is done. You've hand washed, you've labeled, you've triple checked, double checked, you've looked for improper abbreviations, medication alerts, look alike, sound alike, all those things are done. Now you can go. Now it's safe to handle the medication. It's a lot, but it's necessary. Here, preventing medication errors. This is another way. Uh, Something quick. Just take your hand. So you want to have right patient, right medication, right dose, right time, right route. PMDTR. Now, I didn't think of anything, any cool acronym for that PMDTR, but you can, and you can think of something cool or something easy to remember and use that in your practice, to help you make better decisions that will decrease medication errors in your practice. And these are the 5 rights of medication administration. When I first became a nurse, this is something I did every time before I gave medications. I'd say, is this the right patient, right medication, right dose, right time, right route? So by me doing that, that was a practice that stuck with me, and that's something I always check for before I give a medication to a patient. Is this the right patient? I use my 2 patient identifier. Is this the right medication? I check what's been written down. I check the order. Is this the right dose? I look at the medication bottle. I look at the order and check. Is it the right time for the patient? I check the doctor's orders. I check my watch, and is it the right route? Right route is the only one that gets a little tricky because sometimes an IV might not be working. Sometimes the patient might be nauseous and might not want to take the medication by mouth. So that's the only one for me that gets a little tricky. But if you're checking to make sure, then you can note before, oh, the patient's feeling nauseous. I'm glad I didn't take that pill out yet. Now I can call the doctor and say, hey, this patient's feeling nauseous. Is there another route we can give it to him? Or, hey, the patient's IV isn't working. We can't get a new one. Is there another route we can give them this medication by? So, 5 rights of medication administration. Last but not least, we're going to do some review questions. So here is where you can test your knowledge to see what level of understanding you will be leaving this presentation with. Okay, so a nurse administers a 200 milligram dose of Advil to the wrong patient. The patient who received the medication has no allergies to Advil and is being discharged from the hospital later that day. What type of error was this? So the nurse gave a patient 200 milligram dose of Advil, but it was for the wrong patient. The patient who received the medication isn't allergic to Advil, so, oh, hey, I take Advil sometimes, and they're being sent home later that day. So you can presume that they're in a healthy state, they're feeling well, and they're healthy enough to go home. So what type of error was this? And this is a select all that apply because there's more than one answer. So would this be considered an adverse event? Was the patient harmed? Was this considered an error of omission? Was this was this error caused by a lack of action by the nurse? Or was this an error of commission? Was this error caused by the nurse taking some type of action? Was this a medication error or was this a careless error? So I'll let you think about those for a minute and write them down. Write down your answers and let's see. Okay, for those of you who have the answer written down, we're going to move forward and we're going to see what the answers are in 3, 2, 1. All right, the correct answer, if you pick C, D, and E, you are correct. Well, actually, it could just be C and D. I included careless error. I didn't teach you about this, but this is definitely just a careless error. If you pick just C and D, you are also correct. I threw in E just to kind of throw you guys off a little bit. But this is definitely an error of commission. It is definitely a medication error. And it is definitely a careless error. These errors can be prevented. I've talked to you guys through numerous ways that we can prevent these errors, things you can do, things you can talk to your facility to do, things you can look for that other members of your healthcare team, your doctor, your nurse practitioner, things they have done that we can do to make sure that these types of errors don't occur. This nurse was lucky that this medication error occurred to a somewhat healthy patient who did not have an allergy and an allergy to Advil, and instead actually might be taking Advil at home. So no adverse event was caused, but it could have easily been a medication that was more dangerous for this patient to take, and it could have easily been a dangerous medication given to an unstable or unhealthy patient, and this medication would have caused a lot more damage. So C, D, and E. Next question. We're only doing 2, so this is the last one. No worries. This one's a little easier. So a nurse attempts to administer a patient their medication from a syringe. The patient asks the nurse to come back with the medication in 1 hour. Which action should the nurse take first? So a nurse attempts to administer a patient their medication from a syringe. The patient asks the nurse to come back with the medication in 1 hour, which action should the nurse take first? Should the nurse throw away the medication? Should the nurse label the medication? Should the nurse return to the medication room? Or should the nurse set a timer to return in 1 hour? So the patient doesn't want to take their medication for another hour, but the nurse already drew up the medication in a syringe. Which actions should the nurse take first? Hmm. Give you guys a second to think about that. A, throw away the medication. B, label the medication. C, return to the medication room. Or D, set a timer to return in 1 hour. Remember, the nurse is already in the patient's room when the patient says they want to take the medication in an hour. Let's see. Label the medication. Which action should the nurse take first? She should label the medication. Um, this is what we talked about. She shouldn't throw away the medication in the patient's room. You should never throw away a medication in the patient's room unless it's in a proper disposal area. Return to the medication room. First, she should label the medication. This medication should already have been labeled, but if not, then the medication needs to be labeled, maybe with the time she's going to return. And then set a timer to return in 1 hour. But the first thing we're worried about is the medication. So she should label it, then return to the medication room, then throw away the medication or store it, and then set a timer to return in 1 hour after she's done those things. So we've reached the end. Hopefully, I know you guys have learned some things. So specifically, lesson summary, you should be checking off that you understand the different types of error. You understand what a medication error is. You understand what an adverse event, an error, and the difference between an error of omission and an error of commission. You should be able to identify common causes of medication error, um, such as incorrect abbreviations, poor communication, worker fatigue, look-alike, sound-alike medications, and also inadequate training. I included that at the end here, but you guys can't include that because I've just trained you, so you're well on your way, okay? um, Know the importance of reporting a medication error. We talked about the Swiss cheese. Um, the Swiss cheese is a great model, and it demonstrates how easily things can slip through the cracks, how easily they can slip through the hole. The scenario that I described of the nurse picking up medication that looked alike, sounded alike, and the vial she picked up had no danger warning, and she gave it to the patient. She prepared to give it to the patient. Things got busy. Maybe she gave the medication to the patient and then things got busy and she wasn't able to check on the patient. She wasn't sure to check on that. She wasn't aware that she had to check on the patient every 10 minutes or 15 minutes or more so than normal because there was no danger label. Maybe she transferred the medication to a syringe and forgot to put that the medication was dangerous and she didn't know or she forgot. This is why it's so important for you to make sure you use labels on everything that you take out of the vial or out of the pack or out of the Pyxis medication system, okay? You wanna make sure that all these things are labeled because so easily these things can end up, these situations, these medication errors can end up in the worst results. So we wanna make sure we definitely prevent those scenarios. And last, you should be able to identify various safety practices to prevent medication error and understand their impact on patient safety. So first, my favorite was one of the last in the presentation, but the 5 rights of medication administration. You should always use 2 patient identifiers. And another that I think is very important, you should seek confirmation of a message when received during communication. especially when you're taking a verbal or a phone communication order. Also, I included again, label all medications where they are prepared. If there's some others that you remember, that's great. You should be able to identify at least three different practices you can use and implement in your practice to prevent medication errors. And also, you should have a firm understanding about patient safety and understand your role in patient safety. And you should be comfortable with reporting. So, like I said, make sure you talk to your manager and uh, understand what type of safe reporting system they have that encourages workers to report errors. Because at the end of the day, we know that reporting errors reduces medication errors and patient fatalities by medication errors. So we want to feel safe reporting them because we have an ethical responsibility to the patient to make sure that we report these medication errors to keep them safe. Thank you guys. That's it. That's all I have for you today. It was great talking to you about preventing medication errors and different safety practices we can use to keep our patients safe. I want to say thank you again. And my name is Deontay Marquis, presenting to you on behalf of my ALF Training. Thank you guys. Have a good day.